menopause, which is marked primarily by a drop in estrogen levels, but also a drop in progesterone levels and an increase in some other hormones, is something that can literally impact any part of your body. The stats came out between 2024 and 2025 where the use of hormone therapy had actually dropped and it was well below 5%. First of all, aging should not be a cardinal sin. And you can try to stay forever young as much as you want to, but you aren't going to be successful. Do not suffer in silence. The other is, if you are in perimenopause, remember that you can still get pregnant. So I guess I would turn the tables on you and have you pick. My first question would be, have you pick your dominant Unword.
Hey everyone, do me a quick favor and double check that you are a follower or subscriber wherever you listen to the show. I'd be unconditionally grateful. Every new follower, listener, and subscriber helps us keep creating content we love and that you enjoy. It's the best way to ensure you never miss one of my Unconversations. You are on this journey with us, and thank you for that. Thank you for joining us on another episode of the Unconversations podcast. I am your host, Dr. Alison, and today I am absolutely thrilled to welcome Dr. Z. Colette Edwards. She is the Chief Medical Officer and founder of Pausitive Health. Dr. Edwards, thank you so much for joining me today. I'm just so thrilled to have you on the show.
Thank you, Alison. I've been excited about us connecting and having this conversation today ever since the first time we connected. And I have lots of thoughts, lots of ideas, and lots of opinions to share. So,
well, I know that because you and I have met a few times, and we have so many synergies around this topic. And I've talked to so many friends and colleagues who are just at different stages of menopause, scared about approaching menopause. So I am just thrilled that we're going to get into the nitty-gritty of this very, very, very important topic, and a topic that we need to really be able to speak more freely about, not only in our personal life, but also in our places of employment. So
absolutely.
For that level of connection. So before we get started, I like to start every podcast with a segment that I call the Unword Effect. And the Unword Effect is where I ask each of my guests to think of 3 words that have the prefix of un. And these words either mean something important to them personally, professionally, or even in some way with their leadership evolution. And I know that when you and I spoke, there were a lot of unwords that really just expressed every aspect of you, which I thought was so awesome. And even before we started this podcast, we actually needed to kind of narrow it down a little bit, because some of them just were really great. And I think we'll probably be able to weed some additional ones in.
Okay,
but the
good.
one that really stuck out to me the most was unappreciated. What was it about unappreciated for you, where one, that was an unword that you were like, I definitely need to talk about that? Because I think there's some behind the scenes around that word for you. And in what aspect of your life or career is why this word was very important to you?
So I will look at it from a lot of different angles. I know one is obviously for a lot of people in their workplace, they feel unappreciated. It's a common theme that you hear. And I think as each year goes by, it tends to increase. And I think that it is something that is so easily addressed, but is it? It's not expensive to address it, and it makes all the difference in the world in terms of how motivated that person is, how dedicated they are, how engaged they are. And people do great things every day, and I think it should be recognized. Unappreciated means also that lots of talents that people have that may not be immediately obvious are not going to come to the fore because the person is not going to feel compelled to give more when they're getting less. Unappreciated would apply to the menopause journey and how it is so greatly unappreciated by the medical community, by society as a whole, in terms of what it is, in terms of what it means, in terms of the impact that it has on people's lives, in terms of the opportunity it represents. So those are some of the reasons that unappreciated resonated with me.
Did you feel it's the topic of menopause that made you feel unappreciated, or is it also your work on what you're trying, not only through the education around menopause, that you are trying to bring out to the world?
I think that unappreciated, I'm also defining in the true sense of the word in terms of people not really fully understanding something. And I think the menopause journey is definitely one of those areas. And also underestimating the impact that it has, not just on the person on the journey, but the people around it, and not appreciating the degree of suffering in silence that can go on that is absolutely not necessary. So, lots of different ways. I mean, the working in this space is challenging from the standpoint of it's finally starting to get some eartime, but not enough. And when you are working in this arena, you then, some of what you have come into your inbox is tied to the menopause journey. The things that are going to stand out for you when you're reading something will be related to it. And so it can feel like everybody knows about it. And when it turns out to be, no, most people don't know about it. Even women, most women don't know about it. And that became very clear to me when the stats came out between 2024 and 2025, where the use of hormone therapy had actually dropped, and it was well below 5%. So I think that hormone therapy is fantastic for some people, not so much for others for a variety of reasons, but I think that it's something that people need to know about as an option. And the fact that the use went down as more people were talking about the benefits that can potentially accrue told me that your average woman out there going on about her daily life, this is still not something that she may even tie together in terms of symptoms and ask herself, could this be what explains it? Particularly if she doesn't have some of the typical symptoms that people think about, like hot flashes. A lot of the other symptoms are common symptoms that everyone gets. So issues with sleep, being tired, being stressed, well, that describes everybody pretty much.
Sure.
So unappreciated
Dr.
in all
Edwards,
those ways.
yeah, Dr. Edwards, let me ask you this question, and I'm very curious about this. What is it about menopause that, when you say underappreciated, like why is this? It seems like it's this kept secret. I mean, we know that a woman will go through her menstruation cycle, and we kind of have better time talking about it. It's still a private kind of conversation you should be having. But what is it really about menopause, like that it is this secret? Is it because it's not so defined for every woman? Is that why this sort of feeling around it is just so, and it's so ambiguous?
So I don't think that that's what it is. I mean, there is a definition around it. It can manifest in lots of different symptoms, so every journey is unique. But I think that this is just another example of a topic that historically hasn't been spoken about. I mean, there was a time that pregnancy was one of those things that was a hushed thing.
Sure.
Women were not in the workplace. A baby magically came out, but there wasn't a lot of discussion about what was going on, what the needs were. So, it took a long time to kind of slog through the pregnancy component in the workplace. And I think that menopause, which is, another stage of life in a woman's life cycle, another time of hormonal transition, I think is where pregnancy was many years ago. I think that things may go a little bit more quickly, or at least I think so, because some of the generations of women who are in perimenopause now, for example, are of more of a mindset of, I have a problem and someone needs to help me with that problem. I'm going to do my research, but I'm not just going to accept that this is something that is causing issues every day, and I'm just going to suck it up. I think that is much less likely to happen for people who are in their 40s and 50s now than was the case 30 years ago.
Sure. Yeah, I would definitely agree with you on that. So let's go to your next word, unusual. Where did that word kind of resonate for you personally, or within your professional journey? Because I think you're unusual in so many positive and amazing ways, just as I've gotten to know you as we were preparing for the podcast.
So I would say unusual showed up in lots of different points in my life. One was I have always had a tendency to look at things big picture holistically, and how things are connected, should be connected, can be connected. Then that has served me well. Unusual in terms that when I was in high school that I wanted to be a doctor, by the time it came for me to actually apply, I also recognized that I wanted, in addition to the things I needed to know with regard to direct patient care, I had an interest in the bigger picture of the system. And some of that arose because I had taken a basic econ course in college, found it interesting enough to actually take enough courses for it to really be a minor, and so was interested in combining those things, which I did do with med school and business school, going back and forth at the same time. With regard to my specialty, which is actually GI, not GYN, at that time, you rarely would see a woman in GI. And in the internal medicine program that I was in, for whatever reason, at that time in that particular institution, GI was not a popular specialty.
Yeah.
At other programs at the same time, it was, in the top 3. But at that particular program at the time, and that's changed over time, it definitely was not. The last person in in residency that had gone into GI as a specialty had been 10 years before me. But so unusual in that way. I would also say unusual in terms of the path that my career has taken. I was someone who had a plan, knew what I wanted to do, had a plan, and therefore all I needed to do was to execute on that plan. And that's how I started off. And
Yes.
then something came along that I needed to do that definitely was not on the plan. And I ended up, it ended up being a great opportunity, and it made it clear to me that I needed to be more open in my thinking, because if I had just said, no, I'm not going to do that, that's not me, it's not part of the plan, and I'm only going to stick with the plan, then I would have missed out on a lot of opportunities and missed out on finding out that I have been good at some things that I would never, ever, ever have predicted.
Well, I think that's great, because I'm very happy that your plan did take the detour that it did. Because with what you and your organization is doing to help women and continuously helping women, you are definitely not only an unconventionally excellent leader, but you are also an industry leader. And so and an unusual one at that, in the best way possible.
Thank you.
So this next one, I definitely could see with you, and especially with how your path, and I did these unwords in a particular order for a reason. And I think undeterred is, I think represents you well. And I'd love for you to kind of talk about what that unword really means to you in the different aspects of your life, and why you chose that one.
So for me, I think that it's important to do an assessment when you're about to embark on some undertaking, and to determine, is this possible, or let's just be realistic and reality based. Is this really not going to be possible, or will it take so much that it will not be worth it? Once I've made the determination that it's possible and worth it, then my mindset after that is, it's going to happen. It's just a matter of, how do I marshal the people, the resources? How do I communicate the vision? How do I have people work together on a mission to make things better?
Can you bring that example into real life for me? Because is that in relation to how you started Positive Health, or is that just when you first started to embark on helping women around menopause?
So I would say even before that, in terms of working for a Fortune 50 company, not having a lot of resources at all, and still seeing that there were gaps that needed to be filled, programs that needed to be implemented, and that it was crazy for that not to happen. And so I was very fortunate to be able to marshal volunteers across the organization to work on projects. And many people who volunteered initially would still be working on different projects over the course of years, because they had had a positive experience. And so I looked at it as having different people with different perspectives, different skill sets, different talents was going to make the end result better, faster, more efficient, more comprehensive, more focused on the person, looking at things from a different angle. and also providing people with an opportunity to tap into some of the talents that were not being used in the roles that they were in, or their passions that were not being fulfilled within the roles that they were in, and also providing the opportunity for them to provide feedback and input and really have their ideas taken seriously and implemented.
Wow. Wow. Well, I think we're gonna, as we progress further in the podcast, I think your Undeterred is gonna really shine. I would love for you to just spend just a brief moment talking about how you started Positive Health, why you started it, and just kind of a brief understanding so our viewers can understand how important the work that you're doing and your organization is doing.
Okay, so the reason that I got interested in the topic of the menopause journey is really goes back many, many years and is related to an admin that I had who was on the journey at the time. She actually recognized that that's what was going on, which many women don't. She had figured out on her own what worked for her, and she was going on about her life and doing well. At the time, she had a GYN and a PCP, both of whom wanted her to be on hormone therapy. So this came up every time she had a visit. She did not want to be on hormone therapy. And this was also at a time where the Women's Health Initiative study had come out that basically said that hormone therapy was dangerous. You'd end up with brain cancer or a clot, and you're going to be dead in a week, kind of a thing.
Wow.
So when she had one visit with her GYN, he actually got mad at her because she wouldn't take it. So she told me about that interaction. I was pretty shocked. And then I got angry because it made no sense to me. Here is someone who knows what's going on. She's figured out things that help. She's made it very clear she's not interested in it. So you can have your shot of here's what it is, here are the pros, the cons, here's why I recommend it. But at the end of the day, the patient has the final say and you just aren't accepting it. And she has agency and you can't just ignore it. And so then that made me wonder how common that type of scenario was and what people were actually experiencing and what was there to even be learned and to educate women at the time. And I found very little. And what I found was clinically sanitized and did not really capture the true experience. I did some market research then to confirm that this was not a scenario of an outlier experience, and it proved that that was not the case. People felt unheard, unseen, blown off, and were going basically from pillar to post, looking for answers and spinning in the system and not getting very far very much of the time. Life happened, the pandemic happened, and then I saw with some of the technology adoption that happened during the pandemic that maybe there was a way to return to this work and do something at a bigger scale that would impact more people than the book that I had planned and started that was going to be story-based. And that's what brought me to the idea of Pausitive Health, which is a one-stop destination, digital destination for women in all stages of the menopause journey. And so you have access to all types of education that is delivered in different ways because different people learn and process things in various ways. You have access to care by menopause trained clinicians. We have food as medicine, music as medicine, virtual consultations with physical therapists for the joint and muscle pain that women can get, or the pelvic floor issues that women can get. We have community. And so the idea is that the content will be curated, validated, sourced, so that people feel like and believe that the information that they are getting is accurate, at least as accurate as it can be at that point in time, because things are changing. And they don't have to go searching all over the internet and use 5 different AI platforms to figure things out, that we will have done that work for them. The same thing with the other resources that are made available, so they can really spend their time focusing on their symptoms and getting those alleviated, focusing on this time of life as the opportunity that it is, so that they can live their best life. And if they haven't really been focusing on their health and well-being, that they can get on board.
Yeah, I love that. And you and I have talked. I have been so fortunate, and other people are not as fortunate. I, with my OBGYN, have been planning for the moment when I would get to the different stages of menopause that we'll go into here in just a few moments. But that struggle that you're talking about, I didn't realize how real it was until I started talking to friends, my own wife, and just the conversations that were had was like I couldn't even imagine. And this has been something that, being able to talk to my doctor really about anything and not have her stop me and be like, oh, that's a diagnostic question. You go for a preventative.
Yeah.
And so she's a very holistic doctor as well. And I think when we talk about menopause too, I'd like us to kind of talk about what holistic really means, because I think holistic can mean very different things to different people. And I think some of it could sound a little woo-woo to kind of people as well. But your reason for starting your organization, that struggle, I didn't realize how much is real, and that if you're not getting what you need to be an advocate and get what you need. And I'm glad that your organization is here for as a resource for women to do so. Let's talk about what menopause is.
Okay.
And then let's talk about what each of those stages are, because to be honest with you, I got a little confused about it. So, myself, and until I was going through and I was like, oh, that's what that means. So I think for clarity and for understanding, if you could sort of shed some light on what menopause is and those different stages, I think that'd be a great way for us to get started into the topic.
Okay, sounds good. And I think that having people truly understand it is kind of the first step to moving into that advocacy role that is so important just in general, particularly in healthcare, and even more so during this time of life.
Yes.
So menopause actually is the single day that a person has gone 12 months consecutively without a period. When people refer to menopause, they kind of lump all the stages together, but it really is a journey. And there are different symptoms and different changes that happen over the course of time. So perimenopause is the time leading up to that single day, and postmenopause is the day after and the rest of your life. And so you can have certain symptoms that are more common in perimenopause versus postmenopause. You can have the same symptoms, but different severity, different frequency. You can have new ones that are less common during perimenopause than postmenopause, and you can see a different prevalence of symptoms based on, when you look at large populations, based on things like race, and even within race, within ethnicity, where the predominant symptoms may be very different, and also are impacted by things like mindset, which is a big one, education, socioeconomic status, etc. So it's a journey. Most people start in their mid 40s, and the really most symptomatic time that people typically think of when someone says menopause to them lasts 4 to 5 years if you are a white woman. It can last 10 years or more if you are a Black woman, just as an example of the differences.
Wow.
And it's also the case that some women go into menopause earlier. So premature menopause is defined if you have the onset of menopause at an age younger than 40. And if you are 40 or older but younger than 45, then that's early menopause. And so you could go in earlier for things like you've had surgery and your ovaries have been removed, or you had chemo or radiation, or you have an endocrine condition. So there are a multitude of reasons that may be the case, that you experience earlier premature menopause, and those two combined is about 6% of women.
What, in your opinion, so there are some symptoms that happen and a woman may not know. Someone could start having forgetfulness. There are some women who could be on hormonal, didn't even realize they maybe didn't have a period for 12 months or whatever the case may be. What would you recommend for someone that is feeling these things, but they don't want to bring it up to their doctor because they're not really sure if this is kind of, am I really entering into this sort of premenopausal, or what would sort of be some advice? Because, a lot of it could be chalked up to, oh, it's just age. I just turned, 40, or I just turned 45, or where we're not dismissing things even as women, because that's something that we can tend to do. Be like, where we're sort of self-diagnosing, or, oh God, it can't be this. And that's like too soon. What would you recommend for women to do in that sort of situation?
To not doubt yourself or question it, take it to someone and ask the questions. And if you don't get satisfaction, try to find someone else who will listen and discuss what the possibilities might be, including the menopause journey. I think it is, I'm glad you brought up the idea of aging, because going back to your earlier question about it, taboo and stigma in this society, menopause is very much linked to aging, and aging is like a cardinal sin in this country. And so the two things get mixed up and kind of put together when, first of all, aging should not be a cardinal sin. And you can try to stay forever young as much as you want to, but you aren't going to be successful. And then there are things that are more common as you get older. The types of symptoms that women get during perimenopause in particular, like I said, a lot of them are common. You have to also look at, this is a stage when women may be between children on one side, aging parents on the other. Also at a time where career may be taking off. So a lot of different things are changing, converging, increasing stress, which makes it even easier to either suck it up or blow it off, which many women are want to do. I think that people should also not assume, if they don't have hot flashes and night sweats, then they don't have menopause. A high percentage of women do, but a significant percentage of women don't. And you can have, as I mentioned before, things like sleep issues. A lot of people complain of brain fog. A lot of people panic and are convinced that they have early onset dementia and then sit in that fear because they don't want to face the possibility. But you can have weird symptoms too, like burning tongue or getting itchy ears, or you can get into a scenario where you start on this cycle of going from specialist to specialist. So you have palpitations and you are seen by a cardiologist and you have that whole workup. You have joint aches and pains, you're seen by a rheumatologist. And no one is really thinking the possibility that it could be related to the hormonal transition. And the woman herself may not be thinking it either to even bring it up in the conversation. That's why education is so important. I personally believe that this is something that people should learn about, definitely when it comes to healthcare in medical school and throughout medical training, including residency and fellowship, because menopause, which is marked primarily by a drop in estrogen levels, but also a drop in progesterone levels and an increase in some other hormones, is something that can literally impact any part of your body. So that's why I say that the journey is unique, because you can have any different combination of lots of different types of symptoms or have changes in symptoms as the journey evolves. So I know that every time I say this stat, it still blows my mind, but 69% of GYN residency programs don't have a designated menopause curriculum. So it makes it hard.
And still now present.
Yes.
That statistic is still legit.
Yes, in 2026. Wow. So things are getting better. There are more institutions that are working on programming. The Menopause Society has a program that people can go through and get certified as menopause trained. There's an organization called Peri that now has Peri Academy that helps train clinicians. But it is a situation where you can see why a woman may not have a satisfactory experience because the person simply did not get the training themselves.
Okay, Dr. Edwards, I have to ask you this question again at this moment.
Okay.
This is why this is unscripted. I have got to interrupt you at this moment.
Okay.
Because this is just, I will ask this question again. If I need to rephrase it in a different way, help me do that. But what is it about menopause that is so treated differently than any other training? I mean, this is something that you and I both agree on that is going to transpire in a woman at some point. It may be different.
Right.
The symptoms may be different. But at the end of the day, a woman at some point is going to enter into this journey. So why would that not be something? What is it about menopause that this is not as important to include in a doctor's journey when working with women?
So I will try to explain some elements of it. Like I said, every time I see that.
Did I ask that question? Okay.
Yes, you did. Okay. You did. Okay. So that's why I say I will try to explain some of the elements of why that could be. But it does remain that every time I say that 69%, like my whole brain explodes.
Yeah,
so if you go,
mine did. Yeah, mine did. Which now even makes it clearer to me
how lucky you are.
How lucky I am, and why more women. And I will make sure again to probably be on my hands and knees to my doctor because of that reason. Now that makes perfect sense. But please, with your perspective.
So if you go way, way back, this time of life. So if you go way, way back, you also have to kind of remember that people died at a much younger age and they may not even have lived to get to this point.
Sure, of course.
Then when you progress beyond that, when you start looking at history of medicine, you will see that this time of life was kind of described, and women having their symptoms kind of described as, hysteria. And
Sure.
And like your period, where you're supposed to be off to the side and this is your problem and you just deal with it and really don't disturb anyone else with your woman problems.
Yes, correct.
And so I think that there is that element to it as well. I think, and I'm starting to read more and more, that there is a segment of the population, and I have no idea what the size is. I hope it's, a very small percentage, but I think that there is indeed a segment of the population that at a very high level looks at the role of women really is to perpetuate the species. So you've either fulfilled that requirement and had babies, or you didn't. And once the ability to do it is no longer present, then at a high level, you've fulfilled or not fulfilled your role, but pretty much like, okay, what can you do for me now? Except be a babysitter for grandchildren potentially. So, like I said, I think that that's a very small percentage of the population, but I think that it exists. And I think with some of the things that are coming out in today's environment, those thoughts are being expressed more commonly. And once it gets expressed on social media, it's kind of all over the place.
Well, you bring up a perfect example to that, because if that is true, let's say
right.
true, I think it's I don't think it's as small as we may think. I think it may be bigger because with that societal belief, because that's how it gets translated into insurance. And if it was something, because there are all sorts of things around preventative, there's all sorts of more things in our insurance that will help with when you're pregnant and through labor. But when it comes to menopause, that is considered diagnostic in a lot of insurance plans. And in order to get some relief, you have to pay out of pocket in order to be able to do those things. So I think society-wise, if this was something because a lot of plans will cover, let's just say, birth control. Some don't, but some do. And that's not necessarily considered, a diagnostic conversation, as menopause is considered a diagnostic conversation.
So I think it depends upon the plan that you have, and I think that it depends upon probably.
And my question wasn't necessarily around insurance and how that gets handled, but I think the perception around it, and just I'll give you even a clearer example. I could get a routine blood work done. And if my doctor wanted to just check hormone levels just to kind of see where they are, they will extract that hormone piece out of something that's already covered and go, oh no, that is for a whole different thing. This is what is considered under your preventative, is why I just bring that conversation up to you.
Yeah, and I think that this is also a scenario of women having it kind of going and coming from the standpoint of it is a normal life transition that,
Yes.
to your point earlier, if you live long enough, 100% of women are going to go through it. I have had some people suggest, not that they believe that it is a disease, because it isn't, just like pregnancy isn't a disease. But
Yes.
some people believe that if we actually categorize it as a disease, it would be taken more seriously,
Wow.
which is a very sad statement,
That's a very sad statement to make. Yes. Yes.
but
That's a very,
probably true in a lot of
yeah.
cases.
I think you're 100%. Let me ask you this, Dr. Edwards. So you are a holistic doctor, or as you would consider yourself, a holistic doctor. And what would you recommend to women? Because, self advocacy is huge. That is something that has always been within instilled in
Mm-hmm.
me. Now, you and I also touched on this too, from a cultural perspective. So I want to make sure we address that too in my question. So I understand what I'm about to say as a white Caucasian woman, that I've always advocated for myself. I've had to advocate for my own wife. Um, how do you recommend women in all walks of life, of beautiful women, how do you recommend they talk to their doctors, even if it's a female doctor, a male doctor, whatever the case may be? What are some things that you could recommend for women to not be so fearful or afraid to self advocate for themselves, not only just in menopause, but anything?
Everything.
Because yeah, there's this sort of, complex of doctors are here and we are here and this is what the doctor says. And again, I know how privileged I am, not only with my doctor, but also myself, and always advocating. What what would you recommend? Just some things for women to really think about that are going to be listening, going, "Yeah, I need to, but I'm fearful." And what are some things that could help make them a little less fearful and advocate for themselves, just health wise in general?
So I would say that it is not at all easy to do if you have that fear, but you have to either you have to have it come alongside you but not have it hold you back, and it
Mm-hmm.
will get easier over time. I think it's important to be prepared for your visit and organized. I think it is helpful to set expectations of how you want to be treated. And I think you have to force yourself to ask questions. And there's, as far as I'm concerned, there's no dumb question. If you
I
need
agree.
an answer and it's related, even at work, there's no dumb question. If you need the answer to get your job done, it's obviously not a dumb question. More
Correct.
in healthcare, it's definitely not, because you haven't gone to med school, nursing school, pharmacy school, name a school, and therefore you are starting off, most people, at a disadvantage. And that, what's the worst that can happen if you don't ask those questions? Well, a lot of really bad things could happen. You could
Sure.
suffer for a very long time for no good reason. You could spend a lot of time looking for answers because you didn't press the questions or bring up the idea that could this potentially be menopause. And instead of asking the question, being frustrated and upset, but not really in the moment saying, I'm going to overcome it. I would also say, if it were your child, your sibling, your parent, your friend, would you have the same fear if you were there with the visit with that person and you all were trying to get answers? If it were a different person completely and they asked you to come along, would you be fearful to ask the questions that needed to be asked? And I think that that would be much less so the case. I think it's helpful for people to think about situations where people overcome the fear. So, parents with children with cancer or some rare disease, where they overcome the fear because it's their child's life on the line. So, that's just an example of if it were someone else, would you not do it despite the fear? And if you would still do it, which I think you would, then you need to do it for yourself. And if you don't feel like you should do it for yourself, which that's a whole other conversation, then think about, if you are not as healthy as you can be, what are the things that you cannot do for others? Because women often put others before before themselves.
Of course, yeah. I that is one of the traits that I think was instilled in us for sure. To do that, it's interesting because I've talked to other leaders, and I working with my business. I may not be right for everyone. And so if I don't think I can either work with this person or I can help this person or client to the best of my ability, I'm the type of person insecure myself. I'm more than happy to refer them to someone where I think maybe their personalities may mesh better, or the need of their business may be better utilized with somebody else. I feel the same way. There are a lot of doctors out there, and if you feel that you are not getting what it is you need, or if you're made to feel that you can't ask specific questions about your health, then maybe this doctor or this place that you're receiving may not be the best place. And that's where they can look into other resources to get their medical needs, hopefully met. That this isn't just the only place. And that's something I really wanted you to sort of drive home with your comment, was that your doctor is also there to listen to you. And yes, I do want my doctor to be the smartest person in the room. For sure. But I certainly don't want my doctor to make me feel bad for asking a question. Because it may be something we don't need to worry about now, but maybe we need to worry about on my next visit or my next 2 visits. But at least I felt comfortable enough to be able to ask the question.
Well, I think that there are 2 experts in the room, and one of the experts is you, because it's your body, it's your mind. No one's ever going to truly know what you're feeling, what you're thinking. They just aren't. And you, if you're paying attention, are going to notice things that aren't the way that they used to be, that only you are going to really know that fully. So I think you need to, another way to think about it is, they're the expert on XYZ, you're the expert of you.
Absolutely.
Of while you. I think that it is important, if you aren't getting what you need, to explore and search, while recognizing that it can be difficult because of the shortage of clinicians of all type for some people, or the location you are, if you're in a rural setting, etc. Sure. Primary care is, overrun, but that doesn't mean that you don't at least try, if it's realistic to do so where you are. But I
Yeah.
think just thinking that you are the expert of you, I also believe that in my experience, if you take the time to listen to a patient, they will usually give you enough information. It won't be in medical lingo, but they'll usually give you enough information to help you either diagnose what it is or at least get enough information to determine what the next steps are to get to a diagnosis. So that is, active listening is an art form that society needs much, 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 much more in abundance, regardless, but particularly in healthcare. And it's important to know that if you hold back on some things that may not seem important, they actually may be important. And if no one knows about it, it could become a big, big problem for you.
Let me ask you this, Dr. Edwards. As you were talking, it made me sort of think about this. There has been a really interesting little loophole in some insurances. And I can tell you it's in our insurance and it's with Blue Cross Blue Shield. And this isn't for you to analyze Blue Cross Blue
Right.
Shield. This is just a question. But what was fascinating is, when a woman goes in for her woman, let's say, for example,
Mm-hmm.
I'm very fortunate, again, where that is my time that I can talk to my doctor about A, B, C, and D. We may talk about some things like, hey, we may not need to do this now, but let's revisit it next visit, whatever the case may be. However, there are certain things that a woman could mention in their woman that a doctor has the ability to say, this is now a diagnostic, which could be a normal thing as your period. And just saying that word can make your visit turn immediately into not only your woman, but now a diagnostic visit. That has also been the same situation as it is for menopause. And I find this to be very disturbing. I don't know if this is something that you've been aware of or heard situations around this, but it is very much real. And I have talked to other friends where they are very now selective on bringing up issues until something is at a certain point, because they don't want now this to become a financial burden because they're not ready yet to have these discussions. Have you been familiar, or do you have any advice for women that are in that type of situation?
So I haven't heard a lot of stories along those lines. I have been more aware of situations, for example, with colonoscopies that are screening. And then if something is found, then
Sure,
it
of course.
flips. Now,
Yeah, of
because
course.
people have pushed back against that,
Mhm.
that has changed significantly. 100% no. It's going to vary depending upon the insurer. It's also important for people to recognize that if they're getting their insurance through their employer, depending upon how the employer is funding the insurance, some of the decisions are being made actually by the employer versus the health plan, which means there may be another pathway to have things changed.
Mhm.
But I have actually seen more in some of the market research that I did that there are things that are covered that women assume are not covered.
Mhm.
And therefore, you end up in the same place, not getting the care that you need
Right.
because you're thinking it's not covered. And so I think that there are going to be people, and this is one of the problems in the healthcare system in terms of the affordability. And as more
Yes.
time goes on, fewer and fewer and fewer people can afford it. But if you are able to somehow pull some dollars together, I think that this is something that needs to be prioritized. And it
Mm-hmm.
means that you may not be able to do some other things, because if you don't have your health, then you've really got a very, very expensive problem. I
Yeah.
think it's also important for women to know that this is not just a time of having symptoms, it's a time when their risk of both physical and mental health, chronic conditions increases. So, high blood pressure, heart disease, diabetes, high cholesterol, metabolic syndrome, osteoporosis, depression, anxiety. So, that is happening just by virtue of the estrogen levels falling. And so, it makes it even more important to focus on a healthy lifestyle, because you'd rather prevent developing those things than ending up on the other side and having to get treatment for it. Or if you already have a condition, you may see changes in how easy it is to manage. Your blood glucose that has been running fine on the regimen that you've been on may suddenly get out of whack. Or it may be that you've been on an antidepressant that's worked in the past and now it's not working so well. Or you have a thyroid condition and the dosage of the medication may need to change. So, for all these reasons, that's even more the case if you can somehow figure out a way to get the dollars together to not put it off, um, because it has the potential to bite you later. And in the
Yep.
meantime, you're suffering from the symptoms. And there's a wide variety of things out there for people. And that's another thing that I think it's really, really, really important for women to use. Medication, not medication. Hormone therapy, non hormonal options. And so, uh,
Dr. Edwards, let's talk about that. I so agree with you on that, and I'm happy that you brought that up because I was kind of gnawing on the back of my head. Let's talk about that suffering, because I understand that, around health, we have religion has its own mind, we have society, we have family, um, we have, oh, I suffered through this, you can suffer through it.
mhm,
And for me, I don't believe you need to suffer through
mhm,
something. My doctor that I go to doesn't feel that I need
mhm,
to suffer through something. And then we talk about what those things could be, that could help alleviate uh, that. For you, how would you define the suffering, if you will, and just kind of putting that into some medical context? Because people can have different ideas of sort of what that means. And I'll just even bring it to this. There are people, women who have really, really, really bad cramps. And those cramps could be due to all different kinds of reasons. Um, for me, taking hormones was an option. It was great. It helped keep me consistent. It alleviated a lot of discomfort for me. And for other people, for religious reasons, that would never be an option. They did
mhm,
not want to take any type of hormone, and suffering through it, for them, was something that was traditionally sort of in their family, or it was against their religion to take anything. Which I wish we could change the term of birth control, because it does so many other
mhm,
things
mhm.
than that. Again, that's all part of education. I understand. And then finding out it may just not be cramps. It could be other things,
Mm-hmm.
medically speaking, that is causing you to have severe cramps. But bringing this back into menopause, again, what does the suffering sort of mean? Because I have my own sort of definition. I'd be sort of interested in your clinical definition of it and how that relates to some of the women that you work with.
So I would say that a very common scenario would be someone who has really bad hot flashes and night sweats. So then the hormonal changes in and of themselves can cause sleep issues. Now you've got the disruption because you're being awakened by the night sweats. And then you were drenched. You have to change your pajamas, change the sheets, further disruption, more time. Now it's hard to go back to sleep. Then the next morning, you are tired. Over time, that exhaustion happens. When people are exhausted, when they don't get enough high quality sleep, now you've got cravings and now you're eating badly and you're doing things that could actually make some of your symptoms worse. If you have brain fog and you aren't sleeping well and you're exhausted, that's certainly not going to help anything. And I think brain fog is one of those things that definitely many women are not going to want to bring up because they don't want people to think certain things. They themselves may be totally panicked inside because they're thinking that this is the start of dementia, particularly if it's been in their family.
Yes.
And they are trying to do workarounds for forgetfulness and memory issues. So I think that the suffering can be physical. I think the suffering can also be, from a psychic, a mental health perspective. Depression, anxiety, you can have gone your whole life and never had an issue with either. And now you have new onset depression or anxiety, or you may have had it in the past and this may trigger an episode. Or if you're already in the middle of it, then it may become more difficult to treat or the symptoms may get exacerbated. So pretty much in any way you want to look at it, the muscle aches and pains that some women can get, that's another. Being in pain is not fun times. And it certainly doesn't help with your sleep. And then on and on. It's kind of like this whole cascading of repercussions. And once again, I want to say, is there one thing or even a combination of things that's 100% going to take away everything? No.
Sure.
Some people will be extraordinarily lucky. They'll do hormone therapy. Everything goes away. That is not going to be the norm. But there are certainly lots of options out there. And I think a lot of people end up with a combination of different things that, takes a little bit of time to figure out. And that combination may change over time. But there are enough things out there for the vast majority of women to really take control of the situation and manage these symptoms and go on with your life.
Yeah, and I think you brought up something really important earlier on in the podcast, and I really want to make sure that we touch on this. We spend a majority of our time at work.
Mm-hmm.
And, for someone that is at any stage of menopause, and even before, I mean, you've heard of people, I'm late because, they were having horrible cramps and they were late getting to work. And, it's just so stressful, or, they couldn't button their pants because of it. And they're, and now you're at work and everything's all just very discombobulated for you. There are leaders of all levels of an organization, even those entrepreneurs and founders. What do you feel that these leaders in particular, and what can companies do to where this level of conversation, without getting into, HIPAA, right? Of course. But where can, companies do a much better job and support for when because women who are feeling this way, and they're trying to get to work, they're trying to deal with the fog that you talk about, or there's women who, really don't want to mention anything because they may not get a promotion. I mean, we had this issue with women, and even probably even still today with pregnancy, of thinking, well, if I have another child, I'm definitely not getting that promotion. I really want to see how, from your perspective, what companies and leaders in particular can do around this in supporting women.
So I will give you a list of things that employers can do from small to large. And, not every employer is going to be able to do everything all at once, but you've got to start somewhere and then add things over time. Because even if you don't care, if you're the person who is just the bean counter and that's your job, there are dollar consequences for pretending like this is not going on and having symptoms go untreated. So, looking at it from a lot of different perspectives, I think that it is possible, particularly in organizations that have like employee resource groups and already have the one focused on women. Some of them, sliver down to even more focused areas. But let's say there's one for women, or there isn't one for women. You have one for women, and then the topics of discussion are going to be based on the interests and needs of the group. But you can certainly do what you can, number one, to set up a forum where people are going to feel comfortable, and also bring in people to have the discussion. So that's one thing that can happen. So the education happens. I think there are people just having the education and people being told this isn't in your head. You aren't crazy. You aren't imagining it. It is real. This is what it is. And there are things that you can do makes a big, big difference. Employers can have menopause specific benefits so that people have access to menopause trained clinicians. I think that people can have policies at work to accommodate situations that are easy things to do, particularly after having gone through the pandemic, in terms of more flexibility around schedule, the ability for some employers, at least, for people to work at home some days, so that the extra effort of spending an hour in traffic, coming an hour back, having a much longer day, or if they need to take a break at a particular time, being in a better position to do that and then come back and do the work. And for all the employers that thought that if you sent people to work at home that they would become less productive, the studies do not. The studies say the exact opposite. They're more productive. Yes. So then I think it's important for medications that are used to treat symptoms are covered. So that's not just hormone therapy. There are, for example, for hot flashes, there are medications that are non-hormonal that treat hot flashes. There are medications for a variety of symptoms. So I think that there are lots of opportunities to support women to get those symptoms treated, because there are studies out there that say that if symptoms go untreated, then you're looking at about $2,500 per woman on an annual basis in direct healthcare costs. And, some of that is people in the swirl for years, going to all those different visits because of all the individual symptoms, because no one is stepping back and saying, could these things be connected? So that's just one example. And then you have, as I said, you have the cost of the increasing risk of these chronic conditions that could be potentially nipped in the bud. So if you are hesitant because of the cost, it's not going to cost you $2,500 per person
Mm-hmm.
to get the symptoms addressed. So just from a financial perspective and nothing else, it makes sense to do.
Yeah, I would agree. And I think this conversation, I think in companies, you're right. I think we do need to have women focus groups where they, if it is some sort of ERG or something to that, where it's a safe space to really talk about these issues, concerns, just, oh, I was feeling that too. And just, just to create a support system as well, where you're not feeling as alone. I think the other aspect of it too is I think men also need to be more educated.
That's what I was just going to say.
Yeah. And where this needs to be a collaborative thing, and not to be fearful if you're not feeling very, if you're not feeling great. And I'm not saying that men don't have other journeys that they go through
Correct.
in life. But in particular, women, we do have some very painful journeys throughout our course of life that, we need to be able to talk about. We need to be able to say we're not feeling great. Hey, I can do my work just great laying in bed with a heating pad and you're going to get the same level of productivity from me. Or from a menopause standpoint, that women aren't just saying hey, I just want to work from home, I'm feeling lazy, whatever the case may be. That education, I feel, should be very much on the same playing field. What would you please add more to that if you'd like?
Well, yeah, I definitely agree. And once again, I will kind of liken it to pregnancy, where first, if you were a woman, you weren't in the workplace. If you were a woman in the workplace, then if you got pregnant, that was the end of your job. And you stayed quiet about it for as long as you possibly could. Or you then, people thought about you differently because they started making assumptions. Now that you've got a child, you won't be able to do this. And so things have progressed. We now have paternity leave in addition to maternity leave. And I think that we just need to get with the program when it comes to the menopause journey. And let's not take decades to do it. There's just no reason to do it. There are a lot of men out there who have spouses, who have partners, who have different types of relationships that could be of great support, but they need to understand what's going on. And just people at younger ages who aren't going through it, right? To give people, I think that we're at a time in this, in history where we need to try to be as compassionate as possible and give people grace. And to think about, if Alison is acting a little bit different than her usual, then there's probably something going on with her. Now, she may not want to share it with me, but to give some grace to that and understanding. I mean, I have been on a podcast where it was two podcast hosts, one of whom was male, and he was asking, his wife was going through it. What is it that I can do to help or not do?
Right.
Like, zip it.
Those are both great options. Yes, those are both great options. Yes.
What is it, and there was genuine interest. And I think that there are a lot of men who are out there. It's the same thing. And I can tell you, when I am talking about what positive health is about and what the mission is, men who have women in their lives who are going through it at the time instantly get exactly what I'm talking about. Younger, it's more of a glaze over look, unless they remember the suffering that their mother went through, which may not and likely was not shared. So, and in fact, I'm going to be doing a presentation to an agency where they have 10 or 12 different network resource groups. And the session is for all of those, not just for the women.
Perfect.
So
that is great.
yeah.
That is great. Yeah, I think I think what you just described at a minimum is just checking in with somebody.
Mm-hmm.
And I think the way that you phrased that, and the host of that podcast phrased it of, hey, I'm just checking in with you. Just want to know if everything's okay. What do you need? That is not breaking any HIPAA laws. That's not getting into anyone's business. You're just showing compassion that you notice something different in someone, and you just humanly want to go to that person and check in to see if they are absolutely okay.
Right.
That is a minimum. And if someone just says, hey, thank you so much, there's nothing I need, I just need space, then take that's not about you.
Right.
Give them that space.
Yeah.
Because they just told you what they needed.
Right.
And then they're going to circle back around, I'm sure, at some moment and go, hey, remember when I told you I needed that space? Thank you so much for giving it to me, because that's exactly what I needed to take care of myself and to be able to take care of the work or whatever they needed to do.
Absolutely. And I think that this whole idea of calling menopause a disease, I can see how it could be helpful, even though it's not a disease, and so I'm not going to call it one. But I think that people should look at it from the standpoint of getting help. If you do have a condition like diabetes, most people are going to go and get help. If you do have a problem with heart disease, most people are going to go and get help. This isn't a disease, but it's something that can impact your entire body and increase the risk of both of those diseases. So why wouldn't you go and get help?
Yeah, and I think that's a great point to make, because I think to women, of course I'm not speaking for all women at all, I think there is a perception that they feel like the way that they're being treated, that this is a disease. And I think with us being able to have more open and honest communications, that this is part of, we cannot prevent this from happening. If we could, let me know.
Yeah, people are
I'm sure a lot of people are
working on that.
It's just going to make you very wealthy if you can figure that out. And then I'm going to need you to come back on the show for first dibs on it. Or let me go into the business plan with you, please. But and I think if we can have more conversations around that, this is a very natural process, that this occurs for women, I think less women are going to feel like they're carrying around a disease, right, and that they can speak openly and honestly about it.
Well, and through that conversation, I think you can learn about you can learn from people who have a different mindset, yes, just naturally, or people who have their culture is one that does not have negativity around aging and doesn't have negativity around this time of life. And in fact, a woman's stature may actually increase. And so it's a totally different take than the messaging that is going to happen in this country for the most part. And the messaging is the messaging, that someone pushing something onto you, you do not have to internalize it. And if there are other people and other places who look at things differently, then maybe that's something that you should think about doing yourself. I mean, in some of the studies that have happened, it has tended to be the case that if you have a more, at least a neutral, but definitely a more positive outlook on it, then it may decrease the severity of your symptoms, which is just an additional bonus.
Yeah, I would agree for sure. Well, we are getting very close to time, and I wanted to just give you a moment. If there was something that you felt that we left out of our conversation that you feel you wanted to make sure that we talked about. And then we have a wonderful last segment of the show where you get to turn the tables on me and ask Dr. Alison a question. And I hope I get to speak just as eloquently as you have done. But please, if there is any last minute comments that you really wanted to make sure to drive home that could certainly help our audience, please let me give you that moment, and then we'll head into Ask Dr. Alison.
Okay. So I would say two things. The first big takeaway is do not suffer in silence. The other is if you are in perimenopause, remember that you can still get pregnant.
Wow.
So
I was not expecting this second. I was like, I'm with you. Okay. And I was like, oh, that is huge.
Yes.
Listen up, ladies.
Yeah.
Say
So
that again,
people just need to remember that. So there are people who that will be fantastic as far as they're concerned.
Yeah.
And there are people who that was not part of their plan. So if you are in the latter, then just think about the actions you need to take accordingly.
Wow. I bet that is a huge misconception.
I think that there are surprise babies that happen because people were making assumptions that they had gone many, many months, but they hadn't gone 12. And therefore, and then when you hear about the increasing rates of infertility, and after a certain age, it's so unlikely that you'll be able to get pregnant, then you can see how a person can think along those lines and then have an unexpected situation.
Well, then I'm really happy you ended on both of those 2 points. For sure. Thank you for that. Okay, so this is now your time to ask Dr. Alison a question. What do you have for me?
So I guess I would turn the tables on you and have you pick. My first question would be, have you pick your dominant unword?
You know, it's so interesting because I was I was wondering if you were going to ask me that, because I was doing another podcast, and I had my 3 words before when I first started this a year and a half ago, and I would say that my word is unbound.
Okay.
And unbound for me really was something, I think, because I have been able to see not only the evolution of my business since rebranding and the type of work that I just so enjoy doing so much, but also with the level of conversations that I have been able to have with leaders all over the world that want to come on to this platform and have these level of conversations that you and I are are having today. I think that Unword just really fits it so perfectly. I don't know if I would have said that to you about a year and a half ago.
Yeah. Yes.
But now I would definitely say that word, because I just don't feel that there's any. I just think Unbound just fits just so great with the just full trajectory of just my business and the podcast that it's on right now.
Okay. And then I would have one last question in terms
Sure.
of, with all the people that you have spoken with, have you noticed any common themes over the course of the year and a half?
That's a really, really great question as well. What's been fascinating on this podcast for me, as there's some prep that goes into this,
Right.
and just so we can have just a really nice and rich conversation and see where the twists and turns. I never really expected leaders to go back to childhood
Mm-hmm.
with me, and pointing at parts of childhood that were so impactful for them,
Mm-hmm.
and how it started shaping their journey to where they are today. And that it meant, and this isn't something I ask of people, I just ask of my leaders to speak about the human side of their business. I mean, we're all
Mm-hmm.
trying to do the best we can. I think what's been really funny with a lot of my leaders is they've been like, I've been faking it till I can make it. And these are some leaders. I'm like, really?
Oh my God.
Seriously? Um, but they have a dream. They wanted to see come to fruition.
Mm-hmm.
And just hearing about how, they thought they needed to be perfect. They weren't
Mm-hmm.
really perfect. They were really afraid, and here's why they were afraid. And so I think that's really been the common, really the common theme is been, they love just having a platform where they can really talk kind of about the real, issues and or obstacles that they've overcome to be as successful as they are today. I mean, some have talked about sobriety on the show,
Mm-hmm.
that they really needed to kind of get their shit together, to perform to the levels
Mm-hmm.
that they are today. So I think the common theme that is really shown is we're all human. We
Mm-hmm.
all make mistakes. We've all had, sometimes really poor business decisions, and then we've had to pick ourselves up again, and how we've overcome or learned from them is, it's that different journey. And I think that's why when I ask my guests to think about what makes them unconventionally excellent, I'm not here to tell you the answer to that. I want to know, and the people that are wanting to listen to the podcast, what makes you so unconventionally excellent. But the unwords and how people have talked about their process of how they've come up with those unwords,
Mm-hmm.
that has shown some interesting themes. And then specifically what those unwords, and usually those unwords, and not that I did it for this reason, but it really had taken them back to
Yeah,
a
it
certain
does.
particular time in
It
life.
really
And
does.
some of that has been in family or whatever. And I think that's really kind of been a common theme throughout the leaders that I've had on the show.
Okay. Well, I think that is, it does really make you think and reflect, and I think that starts to open up, um, and with you being the person asking the questions, it makes it a lot easier for people to be real and talk about things they might not otherwise have done, and I'm sure sometimes have surprised themselves.
Yeah. It's funny you say that, because just to kind of tag on to that, that has been the case. some of has said, wow, you have this very packaged so nicely and organized. But sometimes the flexibility of how the podcast will kind of
Mm-hmm.
flow as we're recording, and then the podcast will end, and they were like, "Wow, that was a." I had no idea how much I accomplished up until you
Uh-huh.
gave me this opportunity to see what I really kind of did have contribute out into the
Mm-hmm.
world. So sometimes they get off the podcast and there's been like a huge aha moment for them.
Good. Excellent.
Well,
Thank you
I
so much for the opportunity.
this has been absolutely my pleasure. Well, this wraps up another episode of the Young Conversations podcast. A huge thank you, Dr. Edwards, for being on the show, for helping us understand what menopause is, helping us feel more comfortable about talking about what menopause is, and more importantly, that there is support out there and different types of support. And I will definitely make sure that all of your information and how you can support other women will be provided as well. So thank you so much again, Dr. Edwards, for being on the show.
Thank you.
Thanks for being part of the show today. If this episode spoke to you, don't forget to follow or subscribe wherever you get your podcasts to keep the young conversations going.